Hey, y'all, welcome to the Unleashed Performance Therapy Podcast. I'm here with my co host, Robert McNair. Our guest on the show today, Dr. Ken Cooper, is the lead instructor for Master Dry Needling. Dr. Cooper, how are you doing this evening?
Great, man. Thanks for having me.
Yeah, it's good to have you on. I appreciate you taking the time. I know you're a very busy man. Dr. Cooper was my instructor for dry needling, and I reached out to him, asked him to be on, and he was somewhere in the United States, not at home. And he said, my week is booked, but I'm glad to be on next week. So how has that been? Have you been pretty busy?
Yes, we kind of go coast to coast. Well, we haven't gone to the West Coast much because it hasn't been open to dry needling.
Oh yeah, with the
Yeah,
the, the legislature.
right. California, especially. Washington just opened up. Looks like they've got a lot of work to do legislatively before the clinicians out there can start dry needling. But there's, not very many states left that it's not approved for the clinicians to needle now.
That's good that it's everything's starting to open up.
Right.
Kind of jumping into everything. The biggest question that we always get from patients and people who've never heard of dry needling, or they might have heard it in passing, was, "Oh, is that like acupuncture?" And
Oh, yeah.
so I know you have a really good way of explaining things. You've got a great way with words. So kind of tell the audience what the difference between dry needling and acupuncture is.
Yeah, it's the most common question I ever got in practice as well. And so I learned over the years to make my answer shorter rather than longer. And what I learned is the key word is meridian. It
Mm-hmm.
seems like everyone has some kind of foggy notion what meridians or something about acupuncture. And so I explain, first of all, I like to say I have such respect for acupuncturists. And after I went back to chiropractic college and added that license to my physical therapy license, I got certified pretty quickly in acupuncture and quickly realized how really difficult it is to be a good acupuncturist. And so I have all the respect in the world for that group of clinicians. Um, but I explained to the patients that, we don't do meridian balancing at all with dry needling. We actually don't use acupuncture points. We don't try to go in and find the chi like an acupuncturist does with the needle, but we do and use acupuncture needles because they're solid instead of hollow, so the chance of infection is less, and they're very thin, so the pain is less. They're more comfortable. But our treatment is more based on micro needling of the exact tissue that we determine based on our analysis. So we put the needle through the skin and then we analyze tissue and we look for problems in the tissue and leave the needle in those problems as a source of micro trauma. And the micro trauma creates an acute inflammatory process that initiates homeostasis. And so we actually tap in that way to the body's own inherent desire and ability to heal itself. So
Mm-hmm.
that's kind of the distinction I draw to the patient. We don't treat meridians. Acupuncturists do a great job of that. That's not what we do.
Exactly. And I think that's kind of what I always come around to when patients ask me, well, what's the difference?
Right.
And with dry needling, we're specifically targeting those musculoskeletal issues that are happening, whether it be a fascial distortion or just muscle tension in general.
Exactly.
You kind of touched on it a little bit, but there are different techniques that we use in dry needling. Some people who use dry needling in practice will just insert the needle and they'll leave it in there for a certain amount of time.
Right.
Others, they've got pistoning, and then there are other techniques that we can use to attack these problems.
Right.
So, what are some of those that you teach in Master Dry Needling?
A lot of that stemmed from my own experience. I came into the ranks of dry needling much differently than most clinicians. Um, I came into needling actually through injections. My ex-wife a long time ago, was really, really, really sick. And through the course of looking for someone to help her, I met a German MD, PhD, who is an autonomic expert, and he let me take his courses and learn all of his injection techniques. Not so I could inject patients, of course, but so I could inject her and not have to take her to his office. He was out of state. And so most of my orientation came about more based on injection than just dry needling. And when I treated patients, of course, I wasn't injecting because that was illegal. So I would take the techniques I used with the injection needles and just use the acupuncture needles. And what I learned from him that was so good was, learning to trust the body and the body's inherent capacity to heal itself. And so he taught me a technique called needle palpation, and it changed my needling practice. I was already needling trigger points. I had read Travell's book, front to back, and was already kind of a trigger point minded clinician when I met him, and he expanded my entire paradigm into the world of autonomic balancing and also learning to listen to the body. And so, whether or not I leave a needle in the tissue, a lot depends on how the body's receiving the treatment.
And that makes a lot of sense. A lot of times in physical therapy, our treatment is based off of the treatment response, and that kind of pushes our next step towards what
Right.
we're going to do next with that patient. So that makes a whole lot of sense on what technique that you choose when you insert the needle.
Right.
Um, Choosing which technique that you use, it's a big part of how we focus our treatment. What does how do you feel the master dry needling, the way that you teach dry needling in master dry needling? How do you feel that stands out from other courses that people take?
Oh, that's a great question. And we never do. I always, compliment all the other courses. Dry needling works wherever you learn it or whoever you learn it from. But ours is a little unique, a lot because of my background. And like I said, I started out trigger point needling, and then I expanded into autonomic based needling. And then I got hurt in 2008 and was having a lot of trouble. I got hurt pretty badly in a wreck. And I met Tom Delonzo Baker, who's a physical therapist that founded Total Motion Release Technique. And man, again, my life totally got changed. And so I incorporated total motion release kind of into my treatment paradigm. So, master is a little different because it actually has three foundations it works from. It has a trigger point foundation that expanded into autonomics, and then the autonomics and trigger point expanded into total motion release. And so we have a, a big body wide perspective that really tries to look for and harness homeostasis, which is controlled by the autonomics. And so we have a way to look at the whole body and analyze it and record it, and treat it and reevaluate it and know what to do next. And so as we have one of the things that Tom brought on board that was so great is he kind of put it into a package. And recently we've even kind of gelled it more into 7 basic steps that starts with evaluation and goes through treatment, and then it goes through case management all the way till you release the patient. And so it's a unique perspective. But we just try to give you a lot of tools to help you manage the case, not just treat it, but what to do if a patient plateaus and you've done 3 or 4 treatments and they quit getting better. Or what do you do if they come back and say, man, I'm worse now? What did you do? Right? Or how do you know when you're done? How do you tweak the treatment? One of the big things that the questions needlers have is, where do I put the next needle? How do I decide where to put the next needle? What's going to be most beneficial? And so we try to answer all those questions in our classes.
Yeah, I think y'all definitely make a point to answer any questions that we as the clinicians have for you. One of the other questions that patients will have for us is how long is this going to take? Is it going to take one treatment versus two treatments
Right.
versus three?
Right.
Uh, what do you feel like is the? I know the answer is going to be it depends,
Of
but
course.
for
Well,
those
here,
who don't have that background,
right, right.
for the
Here's what
audience who doesn't have that background, what would you say to them?
right, right. So the first thing is I tell the clinician, be nice to yourself, right? So if you say something like, I'll know in 2 or 3 visits, and you haven't been needling very long, that's not being very nice to yourself, right? So, so the first way to be nice to yourself is to pick a big number because you don't know how good you're going to be at reading responses and adapting the treatment to what needs to be done. And the second thing you can do is tell the patient, this all depends on how your body responds. I don't know how your body is going to respond, and you've got to give me some time to learn how your body responds. And so that's kind of a vague answer, but it takes the pressure off you being a perfect needler, right? And getting something to happen really quickly. And so if you need numbers, I always say when I started out, I say it'll take 10 to 12 treatments. And then
Okay.
if I got them well in 6 or better in 6, I was a hero. If it took longer than that, I was not on target, right? So I try to take pressure off clinicians. We've got enough pressure on us as it is.
Either way, you know what you're talking about. There you go.
Yeah, exactly right. Because you want to build confidence in the patient.
hmm
Now,
So,
after, like, say that particular instance there, after those 6 treatments, of course the patient's buying into it and it's working. Now, do you
right.
say, okay, let's stay away from the needling, let's do more stuff that you can do at home, or if they request it, do you still needle them?
Yes, that every clinician is different, but I did
Okay.
because, and part of our system is knowing what to needle next, right, and figuring out what to needle next. So since I was autonomically trained, needling increases parasympathetic response. Initially, it increases sympathetic because it hurts, so it puts you in fight or flight, and you're already in pain, so you're already in fight or flight and sympathetic. Most of our patients are in sympathetic dominance. But I know that if whatever I did at the beginning of the treatment, if I ended it with dry needling, I could put them in a parasympathetic state where they would heal better until I saw them again. So all the other treatments I did personally, I did before the dry needling. But I always, over the years, part of what I learned when I got hurt in my wreck, and I went back to work literally in a cast and a sling. I was impaired, and so I needled more than I had been because I had to. And what I learned from that is that needling is so powerful, and it will not I wouldn't say take the place of so many treatments, but man, it will enhance so many treatments. And so we don't look at needling as a exclusionary tool in our toolbox. If somebody loves Graston, needling will make it even better. And if somebody, whatever technique, whether it's manipulation or Graston, or whatever's in your toolbox that you're really, really good at, we never try to say, let needling substitute for that. Just let it, add to it.
I like that. And I've always said that
Nice.
to my patients as well. It might not fix what's going on with you, but it's going to help heal you faster. It's going to speed up your
Yes.
recovery. And I
Right.
think that's a big thing. Another question that gets asked is, well, what can you do with it? What can you treat with it? And I know there are so many different types of pathologies that you can treat with dry needling. But what have you seen in your experience to be the most successful pathologies to treat?
Well, I kind of cut my teeth on needling with, my practice was in Dallas and I wasn't too far from the Dallas Cowboys practice facility. And so one of them wandered in my office back in 1992. And fortunately, he had a rhomboid trigger point that I fortunately hit perfectly on the very first stick. And
Oh,
it was a home run
showing up strong.
treatment. Yeah.
And the
One
rest
thing
is
I learned
history.
with athletes, especially pros, is you don't have long to capture them. They want immediate results, right? You guys know that.
Yeah.
And so, fortunately for me, he got up off the table saying, "Wow, that was amazing." And so I kind of cut my teeth on the athletic population. And I'd always been a sports clinician anyway, but the standard neuromusculoskeletal things that athletes came in with, I could get very rapid changes with them. And so of course, that's not all I treated. I had a big group of them that came in every week, but I treated all ages. And so I really enjoyed the challenge of people that would come in and say, I've been to 6 clinicians, I'm not any better. And it may be a chronic pain, it may be a sensitization case, it may be a pelvic floor case, it could be almost anything. And I found over the years a way to help them with needling. And so, I still think my most common answer would be sports injuries.
Okay.
Yeah.
And so you say that, and I'm really wondering, is there a different approach to needling with high performance athletes versus the general population?
Yes.
Are you doing it in a specific way, or are there just slight differences?
Well, the biggest thing I learned was to categorize how the players responded to needling, both in the acute injury and in a subacute way. Because you guys know some athletes will respond differently when there's acute injury than they will if it's a chronic thing that they've been dealing with for a while. And so I would categorize them according to how many days or hours it took them to respond favorably. So if one of the players that would get up off the table feeling better, I could needle them right before the game, right? If it took 24 hours, then I knew it had to be a day, and so on and so forth. So I would look at how they responded and then bring them in for treatment that many days before a real important practice or a game. However, that being said, we tend to look at it, we tend to look at needling in 2 ways, like pain or rehab. And that limits needling so much, because injury prevention is, I tell you what, in the research, that's going to become huge. It hasn't been, but also performance enhancement. That's another big thing that I try to do with all the athletes. So I would get them to come in even when they felt like their bodies were perfect, right? Say, let me check you.
Mm-hmm.
Because if there's something going on you're not aware of, maybe I can prevent an injury, or I can enhance your performance, or both, right? So I kind of train them, don't just come in when you hurt or you don't feel like you're 100%. Come in anyway and let me evaluate you. And then we would find a functional test that would show some kind of dysfunction and show a change in that dysfunction after the needling.
Okay, that was going to be my next question. How did you go about showing them that they needed help before they realized that they needed help?
Right. So that's what I would do, is find some kind of functional test that wasn't the same right to left, or wasn't as movement that wasn't as smooth as they thought it should be. And it would always surprise them, right? And I would use that then as a barometer of the treatment. And I would do that whether it was a 10-year-old gymnast or a 60-year-old guy, right? We look for functional deficits, not just does it feel better, does it not, something beyond range of motion, but some kind of functional test to see the effect of the treatment. And so we kind of incorporated that in our 7 steps. And then we would get the patient actually to give it a grade of dysfunction according to how much it bothers them, right? So it's kind of similar to an oswestry, right? You put a number on things that are bothering them, and then they kind of get excited about, as they improve and their function improves, their number goes down because it's not bothering them as much. It's not as apparent in the functional testing.
Was there anything specifically that you saw more frequent than others in some of those high-profile athletes?
Oh, the hamstrings. Always the hamstrings, right?
Always the hamstrings.
And so that's where the training by Dr. Klinghardt helped me so much, because you can, if somebody comes in with a hamstring and their whole leg hurts, you've got to find, if you don't have imaging to show you where the tear is, or if it's a micro tear that imaging doesn't show, you've got to find out where to get that needle. And you can only do that with needle palpation. And so one of the things that we always pass on in our seminars, as you know, is, belly is great, but don't forget the attachments. The attachments are loaded with receptors, and where there are more receptors, you're going to get faster changes in the homeostasis mechanism. And so we get pushed from the bellies towards the attachments, right? So we always added the proximal and distal attachments to the hamstrings from those players, and we really, dug deep for any kind of micro tear or muscle tear, wherever it was, and got the needles right into that place. And the attachments, as you talked about techniques earlier. You can do, in some attachments, you can do periosteal pecking, which breaks the capillaries, which will open them up so stem cells in the form of platelets will get released onto the treatment area. And you can do a kind of a miniature PRP treatment to speed up the healing mechanism.
Absolutely. Are you going to say something, Robert?
Yeah.
It was on his face, wasn't it?
Yeah. It was something that was rolling around. Of course, with athletes, especially the high level ones, you really don't have to kind of beat into their head about like home exercise programs, stuff like that. Whenever you're working with kind of a regular patient, and say you use that needle, and it's almost like the end all cure all. Do you find it, at least when you first started, was it hard to let them know that it's more of a complement to the treatment? Like, you're not replacing anything. You still have to do these basic exercises. Don't just come in here looking for the needling.
No, exactly right. It's kind of like you said, you don't have to ever motivate those guys. You got to like tone them down a little bit, say just for one night, don't do 500
slow down.
Yeah. And so, talk about the difference between the regular population and them. That's a huge one, is learning the benefits of exercise, whether it's a stretch or a functional rehab exercise.
As in the physical therapy profession, we're continuously growing. We're always developing. Techniques are always being changed. New things are being formed. Is there anything in the dry needling world that is new or up and coming? Something that, since I took the course 2 years ago, has anything changed? Or is anything developing in the last 2 years?
Yes. The thing I'm most excited about is, I keep saying, I've preached autonomics, as you know, for years and years and years and years. And now there's finally coming out some autonomic studies. And so the whole sympathetic, parasympathetic balancing paradigm has been, you start seeing it in the research. And so I'm really excited about that. And like I said, we know University of PT school in Florida, proved that 15 to 18 minutes of sympathetic increase happens with needling. We know 80% of the sympathetic fibers reach the skin. And so what I'm excited about that should be coming out soon will be what happens in the 48 hours after that, because what we'll see is a parasympathetic dominance because the body is in a mode to speed healing that we've initiated with the micro trauma of the needle placement. So not only that, but, I read there's a lot of neurology studies coming out, and neuro really wasn't my patient population. But there are a lot of neuro studies with MS and with stroke. I read one recently where they're actually using ultrasound to guide the needle right down next to the median nerve in MS cases to stimulate the nerve purposely with electrical dry needling and getting good results in spasticity and function. So things like that are exciting to me. The other thing that's coming along, you may remember, Jamie, in the course that there's not very much backup in the literature for scar needling. Mm-hmm. And now we're starting to see that too come out. And in fact, there was I had that out earlier. I think it was from Poland. um, yeah, it was from Poland, where physical therapists were using dry needling to enhance the appearance of C-section scars and hysterectomy scars. And you may remember me mentioning in class that I've seen that for decades. I see appearance changes in a scar, but I never do talk about it. I don't promise it. But now they actually published it that you could change
Mm-hmm.
to the scar. And a lot of that, we're going to benefit from the dermatology community because they're studying microneedling because of its collagen regeneration capabilities in skin. And so we've said all these, decades that needling increases collagen production. And now all the microneedling studies are substantiating that. So that's really, exciting for me too.
Yeah, I can testify that firsthand because we needled one of my scars during the class, and it
Oh, I forgot that.
yeah, it changed color, and the whole thing didn't change color, but uh, it definitely made a difference, and it was incredible, and I
Yeah,
think seeing those differences, and you talked about the MS study, that's so amazing, and that's like you said, it's powerful stuff.
exactly. Yeah, especially so I get questions a lot. Clinicians come and take the class that are their entire caseload is neuro, right? And so I say really watch our bibliography because there are a lot of neuro studies coming out and they're very positive in there. And you wouldn't really think so. I would stick in a needle in a spastic muscle help it relax, or a flaccid muscle help it activate, but it does. So
Hmm.
it's really exciting. The potential of
Yeah,
it to me is just unbelievable.
yeah. My introduction to dry needling was a therapist that she was doing the pistoning, and
Uh huh.
this was years and years ago. And now I'm a tech at a neuro hospital,
Oh,
and there's a couple therapists that needle and they do the electrical stem, and I've seen them doing it in MS patients and
uh huh.
spasticity control stuff like that. And
Yeah,
like I said, it's amazing. I've kind of not completely dove into the research, but it definitely interested me because that was the first time I actually seen the needling with the electrical stem. So
right.
it was
Right.
it was wild.
Yeah, and there's finally some. We had to borrow nearly all the research from the electroacupuncture studies because no one was really. It's hard to find someone that wants to fund an electrical dry needling study, right? So big pharma kind of doesn't want to fund it because you know uh, it releases endogenous opiates, so uh, and so it doesn't help their business any in a way. But they're starting to come out. The electrical dry needling studies are coming out too. So to see the research finally starting to it always lags behind, we know, but it's exciting to see it coming out.
Yes, sir. And another big, uh, another big area that can be addressed with dry needling is the pelvic floor. And I know you said that you didn't teach the class, but you have needled the pelvic floor before.
Yes.
Um, so I want to talk a little bit about that because we've heard some things from other clinicians on how it can help,
Hmm.
but nobody we've talked to has really been trained in pelvic floor dry needling yet. And so I want to talk to you more about how that can affect change in people with pelvic floor issues.
Sure. I need to get Lisa on here for you to interview her on the
Yeah, I was
podcast.
gonna say. Well, so
Yeah. Since you teach
I
it.
had been wanting to take the pelvic floor dry needling course, and I
Mhm.
went online and I didn't see that y'all offer it anymore.
Yeah, she's doing it differently than we used to. I need to talk to her and see how she's doing it. Um, so but it's very powerful, and she's a great pelvic floor clinician. And I always, if I ever get a chance to speak publicly like this, I always beg clinicians to please consider being a pelvic floor clinician because there's just so much need in male and female out there. There's so much need for pelvic floor specialists or pelvic floor clinicians. So what I did, we learned injection techniques with Dr. Klinghardt, and we adapted those for dry needling. And so I've treated pelvic floor for about 20 years. And what I did was I found a physical therapist who a great pelvic floor clinic close to me. And so they would do all the traditional physical therapy techniques in pelvic floor. And then if they needed to, they'd send to me for the dry needling of it. I remember one guy was sent to me by DPT in my zip code. He was a boxer and got hit below the belt. And so he had daily severe pain. Anytime he had a bowel movement, he had severe pain. Anytime he had an ejaculation, he had severe pain. He said, I cry every morning when I get up and use the bathroom. It was sad. It's terrible. And so we started needling pelvic floor, and 8 visits later, he was literally just weeping because he could use the bathroom without crying. And so, and we know, you guys, we know it's mainly muscle down there, and we know that half of most of pelvic floor patients are myofascial. And so just because it's there, I mean, it's such a mental block of putting a needle in there, but it's still musculature, and we know what magic can happen. We had a nurse that was having a lot of trouble with bladder control and leakage and things like that. And we actually had a little infrared camera, and the bulbospongiosis was just not filling up with blood at all. We put needles in. We took another infrared picture. Still wasn't filling up. We put stem on the needles of the bulbospongiosis, and then the blood just started flowing in there, right? And she got almost immediate kind of bladder control back with that. And so all of those, dysfunctions that we see in other parts of the body, the still muscles in the pelvic floor, and they would get tremendous results in a lot of cases. And it doesn't hurt as bad as you think. It sure sounds like it would, though. And of course, we know
absolutely
there's scar with that, right? There's vasectomy scars, episiotomy scars, there's all kinds of scars down there, and so they can cause dysfunction locally and regionally and body-wide too, like any other scar, because sympathetic fibers get to the skin, right?
Mm-hmm. Well, I'll definitely have to get with you at some point so I can figure out because I'm interested in taking a class.
Great.
On pelvic floor dry needling.
Absolutely. I'll get you hooked up with Lisa.
Yeah, absolutely. Mm-hmm. Especially, so my wife is pregnant right now. And so I'm really into this pelvic floor stuff. I'm trying to help her be the best that she can be right now.
Right.
And so that's something that I am really interested in getting trained in.
Sure.
It's the pelvic floor dry needling.
Excellent.
And I guess if I'll put any information in the show notes too for other people who want to.
Okay.
So get some training on it. So Master Dry Needling, you are teaching courses almost every weekend, I'm assuming, somewhere in the country.
Yes.
Do you have any other projects going on right now?
Yeah, we opened up a thing with Mitch Hauschild, which is he's a credible clinician. I hate to brag when you say what makes Master Dry Needling different, but I'm just so proud of the teachers we have. I always hated going to seminars, and you go to a seminar and whoever's teaching it, they obviously know their stuff, but you leave the seminar thinking, man, I'll never be as good as that guy or that gal. And none of our teachers are like that. They want everybody to get empowered and outdo them clinically, literally. And so Mitch is like that. He's at Missouri State. Pete is, he was Carolina Hurricanes. He was the physical therapist. He was the athletic trainer. He was also the strength coach. He was anything and everything. So we've got great, and then Lisa is a great clinician too. So it just tickles me to death. But anyway, Mitch has developed an online class. And so if somebody's already trained in needling and they want some more units, CEUs, if they've already been at least had one class, then they can do an online course with him. He does a 2-hour session each month on different topics. And he makes it very focused. A lot of times in the seminars, we don't have time to talk about specific diagnoses because we're just trying to learn how to needle the whole body and be safe. and then he'll pick a topic and do a deep dive into it in a 2-hour seminar at night. So we've got things in the work to try to make it more available, because we know travel is expensive, and so people that want to come to the seminar may not be able to afford it. So we're trying to develop more online treatments, educational seminars as well. And then Tom and I have also talked about getting a level 3 put together, where we put total motion release and dry needling together into one seminar, and to show the power of combining both of those techniques into one treatment session.
That would be great.
Things coming.
Yeah, that'd be great. I think I like the online thing, especially for people who live out in the middle of nowhere in West Texas, like me.
Yeah. Yeah, we're working on that as we speak. So
that's pretty awesome.
By the end of the year, you'll see something.
All right. Well, before I let you go, one last question. Kind of want to throw you off a little bit, get you on your toes. Define what you do in 3 words.
Can I use 4? Is that going to break the rule?
Yeah, sure. Let's go 4.
We're rule breakers.
So what we do really is it consists of 3 8s, ATE. So we initiate, we stimulate, and we even accelerate homeostasis. That's what it does. I was up at Duke University, and one of the coaches say, "Hey Cooper, give me 1 sentence what dry needling does." And I'm like, "Coach, I've got an hour PowerPoint on that. Don't you want the whole PowerPoint?" He goes, "No, I want 1 sentence." And so I said, everything the body needs to do to heal or perform, dry needling will speed it up. So that's the 1 sentence I gave him. So he caught me off guard, man. I was kind of proud of that answer, because I was not ready for that question.
Got a whole presentation, right?
It's a 4-word answer. I'm sorry, I broke the rule.
Nah, that was a good one.
What was it again? Initiate,
accelerate,
stimulate. Right.
Initiate, stimulate, accelerate, homeostasis.
Yeah.
All right, I got it.
Does.
All right.
So the better you are at palpation with the needle and figuring out where the body is kind of leading you to go, that's one of the things that Germans, were so good as almost a foreign concept to me, is that if you'll learn to listen to the body, it will help you, because it wants to get well so bad. It's programmed to heal itself. And so he gave us a lot of autonomic clues how to do that. And so he always said, "Hey, guys, you don't get anybody well. Homeostasis gets everybody well, so quit taking the credit for it."
Well, I can tell that you were my instructor, because that sounds a lot like the answers that I give my patients. So I know that it's not coming from just anywhere.
Yeah. So the Germans produce Einstein, they produce Klinghardt, so they're pretty smart cookies over there.
Well, Coop, I really do appreciate you taking your time.
Absolutely, guys.
I know you're busy traveling the world, teaching dry needling to everyone, but we really appreciate you being on. It's been a pleasure having you.
Yeah, thanks for having me, guys. It's been a pleasure.
Yeah, and hopefully we can get together soon.
Yeah, I'd love that. We can catch up some more.
Absolutely. Well, that's going to be it for this episode of the Unleashed Performance Therapy Podcast. If you have anything you want us to talk about on the podcast, send us a DM on the Instagram at unleashed.tx. And y'all, be sweet to me. Scroll down to the bottom, give me a 5-star review, share the podcast with your family and friends. And until next time, peace.